Hi everybody, I'm Dr. Izadi from Preston Wellness Center, and today I want to talk to you about hair restoration and PRP. As you know, PRP stands for platelet-rich plasma, and we extract that from the patient's blood by doing centrifuge and separating platelets and growth factors from the rest of the blood, which is red blood cells and white blood cells. In terms of PRP treatment for hair restoration, there are few things that everybody should know. First of all, not every PRP is the same. There are different methods to extract PRP. Two major ones are either single spin using separating gel, or double spin using the Buffy coat suspension. So when we do single spin, it means that we separate the cells, white blood cells, red blood cells, from the rest of the blood. And when we have less cells, means that we have less inflammation after injection. And that is good for hair restoration because one of the major causes of hair loss is inflammation, and that's why Nizoral shampoo helps with hair loss, because it decreases the level of inflammation on the scalp. The double spin using Buffy coat suspension leaves some cells, red blood cells and white blood cells, in the final product, and that can be a cause of inflammation. Inflammation is good when you want to do skin rejuvenation, because inflammation can cause collagen formation and tightening of the skin. So when I use PRP for skin rejuvenation, using it with microneedling or using as tissue filler, I use the Magellan or Harvest centrifuge machine with their special kit. And when I want to use PRP for hair restoration, I use Eclipse. And there are two things that you need to know about PRP. One is that when we use lidocaine as topical anesthetic, like cream or injection to control the pain, studies show that it can cause decrease in the effect of growth factors for hair restoration. And the way that we use PRP with very tiny needle and using other tools to decrease the pain makes it very tolerable for patients, and we don't use lidocaine for that specific reason. Another thing is that if you use activators like calcium chloride or calcium gluconate in PRP, activation of PRP study shows that it decreases the amount of growth factors that are necessary for hair restoration. So that's the reason that we don't use that in our PRP product for hair restoration. And also calcium chloride can drop the pH, makes it very acidic, and cause more pain and discomfort at the time of injection. In terms of the number of treatments that we need to see the result, in some patients we see the result after the first treatment, and in some after third or fourth one. Depend on how severe the hair loss is. We can use one treatment every month for 3 months, and then every 2 months 3 times, and for the rest of it as maintenance therapy every 6 months. PRP should work. I hope this video is helpful for you to understand how it works, and if you are science savvy, I have the articles, the research regarding hair restoration with PRP on my website, and I encourage you to visit my website, pristinewellnesscenter.com, to see before and after pictures and also the studies. I hope to see you here soon. Thank you so much for your time.